how this relates to the Affordable Care Act in some very specific ways. And let me give you 3 examples. One, does the health exchange go away at the state level if you implement and have approved, of course, a state or regional based plan? What's the position on abortions? Is that abortion care, is that an essential benefit or not? If those kind of questions that I think need to be sorted out, because I can imagine that when all of us are speaking to groups about how we can move forward to achieve a single payer universal healthcare system, people will ask those questions about implementing a state-based plan, and we need to know the answers. The last time I checked, there were 20 co-sponsors, including my own Congressman, Joe Neguse, and all of them were Democrats. Next slide. It's referred to all of these committees that are listed. Next slide. The purpose is to authorize the establishment of state-based or regional-based universal healthcare systems. Next slide. The reason the act is needed is to cover everyone at the state level. Each state needs federal approval and federal funds to cover the people who are currently covered by federal programs. Next slide. How would the remaining costs be covered? Probably the remaining costs for each state or region would be from a tax. They would tax residents to pay for the cost of care for the people who weren't already covered by a federal program. Next slide. Some of the residents' taxes would increase. In almost all cases, the tax would be less than residents would pay in premiums, deductibles, and copays, and the benefits would be as good or better. Next slide. Why not cover only the people who aren't eligible for federal programs? Well, the answer is that states need the best possible economy of scale to keep the taxes as low as possible and provide the best benefits. Next slide. Why go state by state? Because it's the most politically feasible. Some states are ready to achieve universal health care. Other states are not ready. Next slide. How the state-based Universal Health Care Act would work. It amends the Affordable Care Act by adding waiver 1335. And it's called the Waiver for State Universal Health Care. Next slide. A state or states as a region could apply to the Secretary of Health and Human Services for a waiver. Next slide. The regional waiver request, 2 or more states can form a region and submit one application for the region. And let me just comment right here that when I read through the legislation, it looked like there was a clear intent on Congressman Ro Khanna's part to try to simplify the application process, not to play one of those nonsensical federal games where you say, yes, there's a program, but it's so hard to apply for it that nobody ever does. This one looked like they were working hard to make it something that was reasonable in terms of process. Next slide. A single application is a part of what I was just talking about. Several federal agencies have oversight for specific federal health programs. The federal agencies must coordinate their efforts to make it easier for each state or region to apply for the waiver. So in other words, instead of some poor state that has good intentions trying to apply for this waiver and sending one to the Health and Human Services and another to FEMA, God knows why, and another to another agency at the federal government, the law says if it passes, you only need one application and it goes to all the federal agencies that have any oversight to make it easier for each state or region to apply for a state-based or region-based universal health care plan. Next slide. The state plan must cover at least 95% of all residents within 5 years. Next slide. State residents are U.S. citizens and U.S. nationals. Next slide.
What does national mean?
Yeah.
I think that they have some right to be in this country but aren't technically a citizen, but we should probably get a definite definition for that. Next slide. State resident aliens are who are lawfully residing in the state, and also dreamers are included in this. Very specifically, the Bill 5010 includes dreamers. Next slide. State resident primary residences in the state. Next slide. Here are the exceptions. Native Americans are not covered. And when I asked about that, and that's one of the questions in my list of questions is, why did we leave them out? And the answer was, it was probably a political decision that the Native Americans wanted to be sure that the benefits that they have right now for healthcare coverage would not somehow be compromised in any way by some sort of state plan. Next slide.
There's a sovereignty issue there, I think, even more than like they might lose their benefits. I mean, and that's a long-standing issue, and it affects a whole lot of different areas of public policy. But they have their own health plan because, you know, yeah, it's a matter of autonomy and respecting the integrity of the tribal government. That's why, and I think that exemption exists in 1384 too.
So, just good to know. Nothing wrong with that part of the bill. Just good to know it. But it says states may not require enrollment of an Indian. So that implies, I think, that a Native American could also enroll in this. Next slide. American Indians and Alaska Natives, no enrollment fee, premium, or similar charge, and no deduction, copayment, cost sharing, or similar charge is to be imposed against an Indian. All costs incurred in waiving such charges shall be borne by the federal government. Next slide. Funding. Combines several federal healthcare funding streams, creates a state tax to cover residents not covered by the federal healthcare program. Next slide. Federal healthcare funding streams are the Affordable Care Act, subsidies, and tax credits. Next slide. Medicare, Medicaid, and Children's Health Insurance Program. Peter.
So the employers in the state with the plan would no longer be required to offer, or would no longer be offering health insurance to their employees, and they would no longer have the tax deduction that goes with it then. Is that correct?
You mean for what program?
Well, it's like if, North American Widgets has a health plan for its employees and they get a big fat tax deduction for offering it. They would lose that tax deduction.
That's right.
And they would no longer be offering the health insurance to their employees. So actually,
Well, I'm not sure about that. If the state taxes, if the state-based plan that the state creates and is approved by the federal government for the people who aren't already eligible for a federal program, it could run through the employers. I don't know that it would or should, but I guess that it could. Right.
The employers might be used to collect
Right.
the money, but they would not be taking it out of their, out of their revenues. It wouldn't be a business expense, so they wouldn't be able to write that off and get the deduction.
Yeah.
So Peter's
Correct.
right.
Right. Okay, that makes sense to me too. Yeah. But it could run through their payroll, depending on how the state set it up. I would
Right.
think the state would want to separate it out from the employers. But I don't know what the state plans. I don't know exactly how each state plan would look. Next slide. So this is just another long list of the federal healthcare funding streams. The Federal Employees Health Benefits Plan, TRICARE, ERISA, Early and Periodic Screening, Diagnosis and Treatment, EPSDT.
So that's great. I couldn't remember whether
Okay.
it was covered on this bill or not. I know that that was an issue that when Vermont was looking at trying to do this, that we did not have anything to cover us to address the ERISA if we did not have a bill like this passed.
Right. I think that's one of the big things in 5010 is the ERISA section. And I'll be glad to send, this whole PowerPoint to everybody. And I think that your questions indicate why it's going to be very valuable for us to have an in-depth conversation with Will McKelvey and get some answers to some of the nuances, some of the things that are left sort of up in the air about 5010 that we need some clarity about.